make sure that it shows it.
I thought you had to show these people back here.
I did, but
Ah.
not show it up here.
I'm gonna have to come around there.
I really was.
All right, y'all ready? Traction splint is an integral part of the pre-hospital care system. You're going to use it to splint a femur fracture. It's somebody's in a wreck or something, you splint the femur fracture. It was introduced by John Hilton in the 1860s. It's been modified several times since then. It started out more or less like just a one-legged, one-barred splint. Now it's become into something like this. I'm going to demonstrate how to put it on the leg. It's a long bone fracture is extremely painful. Once it's broke, the bones actually shorten and they kind of go on top like that, and then the muscles quiver. So once we can pull traction and kind of straighten them out like that, it actually gives the patient pain relief. So we're gonna demonstrate how to do that here. Dustin's gonna be our patient. First of all, you have to measure it against the good leg. So we're gonna act like Dustin's leg is broke on this side. So what I'm gonna do, Shelby's gonna act as my partner here. We're gonna first take manual stabilization of the fractured leg, and he's gonna hold that, and then we'll come around and we'll put the ankle hitch on, check our pulses in this foot. Do you have a pulse? Do you have a pulse, sir? Can you feel this? Can you move your toes? Go ahead and apply the ankle hitch. I dropped it.
Nice. Expose them to the white
Try to do this with minimal movement of the leg. Again, the idea here is to give the patient relief from the pain as quick as you can. So we want to go ahead and pull traction on this leg. So we'll go ahead and pull the traction. How's that feel? Pretty good? So then we'll hand that off to my partner. While he's holding that, this is gonna, the traction pull alleviates the pain from the traumatized muscles. And then what we do is we measure this splint against the good leg. You measure it from the ischial bone here in the backside to the bottom. This stand measures to the bottom of the heel here. So we've got it measured out. We'll go ahead and set our straps. And then, just for purposes here, we're going to let Dustin slide to this other side. And I'm going to come around.
Yep, and go on the other side, Jesse.
Stay out the way. Now we're going to lift up his leg just enough to slide this under. And we'll keep that straps. We've got to get it up under his bottom here. Okay. Now we'll lower his leg. Now the first strap you always put on is the ischial strap. Push it out here. One thing about it, you have a femoral artery that runs right through there, so you always want to place some padding there. This strap needs to be pretty tight to secure the splint. You apply that strap first. Now, you will attach your ankle hitch, set it, tighten it down, pull traction. How's that? And you just come back. Knee, you don't want to put a strap over the knee. got him secured. Now we're gonna check a pulse. Have a pulse. Sir, can you feel this? Can you move your toes? Now the last thing we would do is we would secure the patient and the splint to a long spine board, making sure that the splint and the patient was secured along with his torso to the spine board. That way he wouldn't fall off and the splint was secured. Because that splint wobbling around and stuff would also hurt the injured bone. Because right now we've got the bones pulled back together, and it's giving the patient relief, because before the bones were jagged and they were like this, and now they're actually pulled back and they're straightened, which is also taking the pressure off these muscles here. So the traction splint serves a vital role in EMS on long bone fractures. Training, if they don't have proper training on one of these, it's not advised to let them use them. EMTs and above is who uses these. First responders, they don't have these on their fire trucks and such because we don't like to see them use them. They don't have the proper training. They'll get out there, have these things splinted, they'll have them on upside down or something, and that wouldn't be cool. We'd show up and be more damage to the patient than what it was worth. So we make sure that when we put these splints out there, that the people that are using them have the proper training. You don't use these splints if you have an injury below the knee. These splints are only used for femur fractures. Nothing below the knee. If you have some sort of injury that involves the ankle, knee, joint, anything like that, we don't use them. So only femur fractures. I had a doctor one time tell me to put one on an ankle fracture. I had to correct him. I was like, no sir, we don't traction splint ankle fractures. And he was like, well, okay. But he was adamant we was going to put that traction splint on that ankle fracture. And I was like, no, not on my truck, we're not. So anyway, we pillow splinted that fracture and went on to the hospital with it. But these things, we don't use them a whole lot, but when we do see a femur fracture, they come in really handy. The only drawback to them is they're long. So if you have a patient that is long-legged and you have to extend this thing out really, really long, the back door of the ambulance doesn't like to close. So then you have problems there. Plus, getting in a helicopter for flying patients, sometimes these things don't fit in the helicopters. But normally, you don't have a lot of complications out of them, and they're pretty good devices. So, the only other contraindication really you have with them are pelvic fractures. You don't want to use them with a pelvic fracture. But again, pelvises are joints. We don't use them in those fractures either. So there are training classes offered through your EMT classes and such. So that's when you're going to learn to use those. And when you get your EMT certification and you get on ambulances and such, you're allowed to use them. You can cut it off. I know.
Just
Slightly.
push
I
OK.
can't feel my good.
Push the power,
Oh, shut.
the G button on top.